While it is helpful to meet with community leaders and volunteers, it is also valuable to meet regularly with the larger community. At a community discussion, health workers can provide updates on immunization services and their importance. And community members can provide honest feedback and suggestions. They can also ask questions and share concerns. At least once a year, meet with the communities where you offer immunization services. For each community discussion, you will need to schedule the meeting, facilitate the discussion, and share the information gathered so solutions can be planned and implemented. Start by talking to community leaders and groups. Propose a meeting and explain its purpose. Ask them to suggest the best time and place for the discussion. Work with local leaders to invite everyone with an interest in child health. Make sure that women and religious and ethnic minorities attend. In some situations, it might be best to have separate discussion groups with men and women or with different minority groups. Discuss the meeting's objectives with community leaders. Ask for their suggestions. Ask your community partners to inform others about the meeting. Let attendees know in advance what you will provide, such as health education materials on immunization and drinks or snacks. A health worker can facilitate the meeting either alone or with one or two community representatives. During the meeting, have everyone sit in a circle or in a similar arrangement that allows participants to see each other. The group can sit on chairs, benches, the ground, or any appropriate seating. The facilitators should sit at the same level as the community participants. If culturally acceptable, encourage women not to stand at the back of the crowd, but to come forward and participate actively. While men's opinions are important, women are likely to have more experience with immunization services. Begin by thanking people for organizing and attending the meeting. Then, clearly explain the meeting objectives. The main objective is to improve immunization services to keep their children as safe from vaccine-preventable diseases as possible. There should also be more specific objectives, such as gathering feedback or choosing tasks for volunteers during immunization sessions. Also, ask for comments and suggestions for additional objectives. Have someone from the community and health center take notes that can be finalized after the meeting for future reference. When sharing information about immunization services, use clear, simple language and avoid medical or public health terms. Avoid moving into a lecture. Take this opportunity to share important immunization data, such as coverage and dropout rates, and notify of cases of vaccine-preventable diseases in the community. You may also want to publicly acknowledge caregivers whose children are fully immunized. Ask a lot of questions and encourage wide participation. Encourage everyone to express their doubts and ask questions. Brainstorm ways that the community can assist with immunization services, and acknowledge community members who are currently helping. Ask how many people agree or disagree with certain points or ideas. Use informal voting to clarify opinions or suggestions. Just before ending the meeting, ask for volunteers to summarize what was said and agreed upon. Be sure to review the specific commitments made by both health services and the community and decide how these commitments will be monitored. You should also agree on a tentative time for a follow-up meeting. Then, of course, thank everyone for attending and participating. Following the meeting, you should share the information gathered and carry out action items from the discussion. If notes were taken during the meeting, arrange for them to be finalized and distributed. If particular problems, either in health services or in community perceptions, emerge from the discussions, try to address them as soon as possible. These may be addressed in microplans or in actions for health staff and community partners. Make the district or central levels aware of any problems or activities that they may need to address or support. Put a plan into place to monitor the commitments made at the meeting. Now you know how to schedule, facilitate, and share important information from a community discussion.